Lyman, and I am thrilled to introduce the first of our hot topic speakers today, Dr. Iona Novak. It's truly my honor. Dr. Novak is here from Cerebral Palsy Alliance and Allied Health in Sydney, Australia. So she traveled from around the world to get here. Iona is an international keynote speaker and Fulbright Scholar. She is widely regarded as a trusted source on evidence-based practice. Her research aims to discover, test, and translate new treatments in priority areas identified by people with cerebral palsy. Iona has made significant contributions nationally and internationally in early diagnosis and the discovery of new therapies. She's going to be speaking today on stem cells and giving us a stem cell update, and I've heard and seen some of it, and it's really exciting. So, Iona, welcome. Thank you.
We're going to talk about this topic today, the potential of cell therapies for cerebral palsy. Where are we at today? So I think there's been a lot of hope in this field, and there's also been a lot of hype. So we're going to try and cut through and get a bit of a summary of where we're up to, because I'm sure if you have a go at trying to read about this topic, there's thousands and thousands of journal articles, and there's hundreds of web pages that sell you lots of good ideas. But where are we at scientifically, and what are the best possibilities? So I'm going to review this paper that we wrote recently. If you want a copy of it, that QR code will take you to the full text paper if that's something you'd like to talk about. So we've been doing stem cell research with people with cerebral palsy for 15 years now, and at least 2,400 people have had a stem cell treatment in a clinical trial. So that's actually a lot. It's almost more patients than in most of the proven interventions in cerebral palsy. So it's an interesting conundrum because there's been actually a lot of research, but there still isn't any treatment that's been approved. So we're going to have a look at why is that? Is it just hope or is it hype, and try and cut through to the bottom of that. So if we start a little bit further back, and those of you in the room will be even more familiar with this with your own lived experience, but there are a lot of treatment options for people with cerebral palsy. There are over 180 in the published literature. There's even more on the internet. So when you come to make a decision, should I do this or that, there's a lot of information to sift through. Another thing that's been happening is there's been a lot of work in the prevention of cerebral palsy. And in high-income countries, the rate has fallen by 30 to 40% in places like Australia. It's less certain in the US how much it's fallen because you have a different registry system to us. But we can see that very early interventions with mothers during pregnancy and with babies in neonatal intensive care is actually preventing some cerebral palsy. And for me, what that means that we can do more. It means that brain repair options are available. It's about timing of treatment, understanding the best treatments, and so this is an exciting fact. I guess it's also important to say we really understand a lot more about cerebral palsy and its causes these days, and we know that some of the cause of cerebral palsy is genetic. So that's why no two people with cerebral palsy are the same. The causes can be different, the presentations can be different, and that's why stem cell therapy is not really a one-size-fits-all. There's lots of cells and lots of different people. So we'll try and go through that. But what we are learning a lot more about is the different types of cells that might be helpful for people with cerebral palsy, which doses they need to be at, when to give them, and how to give them. So we'll go through these. So just to backtrack a little bit, if stem cells is not your jam and you're not very familiar, stem cells really have to do two things. So first of all, they have to be able to make copies of themselves, and we call that in science renewal. So they make copies, identical copies of themselves, like a big photocopier. The other thing they have to be able to do is choose a career. So if they don't choose a career, they're embryonic. If they choose a career and they specialise, or what we call differentiate, then they have a certain job. And once they've chosen a job, they can't go backwards unless you use a particular technology. So that means if it chooses to be a blood stem cell, then it's going to make more blood stem cells. It'll make white blood stem cells, red blood cells, etc. Whereas you can't use a blood cell to repair a brain, but you could use a brain cell to repair a brain. Do you understand what I mean? So the differentiation, the job it chooses, somewhat determines what the cell's capable of doing, what it's specialised for. So there are a lot of different cells under investigation for cerebral palsy. Some of the best known ones are umbilical cord blood, which comes from the umbilical cord, which most people are going to throw away. So it's an easy type of blood to collect and to store and to freeze. It can also come from the placenta, so amnion epithelial cells. Then we can have neural cells, brain stem cells, which are the ones, of course, we're very interested in with people who've had a brain injury. And then we can have other cells, so hematopoietic, which is a fancy name for blood, stem cells, and they can be in your bone marrow, so in your big long bones in your leg, in the femur, or they can be in your fat and knee joints. So you're probably making stem cells as you're sitting there in your joint tissue. And so how do all stem cells work? Well, all stem cells can have one of the following three actions, but some of them have more than one. So they could be anti-inflammatory. So I think we talk a lot about inflammation in conditions like arthritis and inflammation in general with a range of health conditions today. We're going to talk about inflammation in cerebral palsy. They might be able to replace damaged cells. So blood cells can replace damaged blood cells. Brain cells can replace damaged brain cells. So it depends on what they're differentiated to do to what they can replace. But they can also do what we call trophic effects. So that's about growing new things. So if you put a blood cell in a brain, it can't make more brain cells, but it can talk to all the structures around an injury and make more blood vessels, which produces more blood to an area that's injured, which can help heal. So there are lots of different things they can do, and that's why they help people with cerebral palsy in different ways. So this is an important chart written some time ago by Professor Donna Ferrero, who's a keynote at this conference, but we've added a little bit to it. So if you think about a brain injury and you think about it as a time of loss of oxygen, that's one way a brain injury can happen. We tended to think about that as minutes without oxygen or hours without oxygen, and we think about that as a short-term injury. But what Donna Ferrero was able to show is that injury pattern actually goes for at least a week. So even though you've got the oxygen back on board, your oxygen levels are back up, the cell processes that are happening in the brain, cells can still be reacting and some of them dying. So that process actually goes on for a week, depending on how long the injury was. But what we know now is in this blue bar that we've put on here, we've been able to show in work with people with cerebral palsy that inflammation persists at least 4 years after the injury. So it probably goes longer, it's just that that's where the studies we were looking at cut off. So there's this persistent inflammation, and inflammation, you probably know, isn't really healthy. It's great at the beginning of the injury because it starts a healing process, but then when it's not put in check, it can get out of control and make a lot of cell mechanisms do sort of naughty things. And so inflammation is very difficult if it's long-term, but we know it's long-term in people with cerebral palsy. But I said before that one of the jobs of stem cells is they're anti-inflammatory. And this is why we think stem cells might have a role for people with cerebral palsy, because there is this persistent inflammation. It's what we call a treatment target. So when we're starting to think about the timing of different cells, I've got down the bottom there in orange some of the things that work against the early injury and can rescue some of those cell processes are umbilical cord blood, mesenchymal stem cells, and hematopoietic stem cells. Whereas if you wanted to do something really late and all the oxidative stress and other processes are finished now and you've just got inflammation to work on, or you've just got a repair target, then you'd want to use a neural stem cell. So we're starting to understand more about the timing of the different kinds of cells. So what about safety? Well, there's, as I said, thousands of people have had cells if they have cerebral palsy now, but also in other indications. And we know that umbilical cord blood, it's been used for 50 years in a range of treatments, is very, very safe. It's safe if it's your own umbilical cord blood, and it's safe if it's a sibling's cord blood, and it's also safe if it's an unrelated donor. So that's been one of the questions, and that's been really important that we've been able to show recently that unrelated donor cord blood is very safe, because most people don't know before they're born they're going to have cerebral palsy, they don't store a cord blood unit, so it limits how feasible that treatment is. But we now know you can use an unrelated donor cord very safely, and so that's really going to expand options for treatments for people. And we also know that neural stem cells from a donor are safe. You can't, of course, use your own. I can donate a kidney, I can donate blood, but if I tried to donate some brain, I'd actually end up with a brain injury myself. So you have to actually, deal with brain stem cells in a different way. So there are also sorts of considerations that we think about with stem cells. So we think about, are they coming from yourself or coming from a donor? If they're coming from yourself, are your cells in perfect condition, or are we going to increase the injury by giving you more injured cells, for example? If they're coming from a donor, is it a good match with you, or are you going to reject the cells because your immune system works out, well, they're not my cells, I'm going to clear them. There are moral and ethical complexities, but the sort of cells we're thinking about are cells that have already chosen a job. They're usually in discarded tissue, so we're not worrying about this issue. We're thinking about umbilical cord blood, cells that have been donated by organ donors, for example, under consent. We think about how do they work, because if you want to fix a problem, you need to get a solution that actually matches the problem. So we think about something called mechanisms of action. And then you think about when and how much and what are the risks. So let's have a look where we're up to. So a paper that we wrote in 2020 is called the traffic light paper. And if you want a copy of this, there's the QR code down the bottom. But I'm just going to show you today just the section on the stem cell piece. I've just pulled that out. So just to orientate you to this graph to start with, down the vertical axis, at the top are the effective treatments, and at the bottom, the red ones are the ineffective treatments. Then we have this dotted line called the worth it line. So things can be above the worth it line, they're worth doing, or below the worth it line. So that's sort of how the schema works. So if they're green, they're proven to work. If they're red, they're proven not to work. And if they're yellow, more research would help us understand more about this. But we're looking for yellow things that are above the worth it line. So just to say here on the stem cell section, we've got one green light, umbilical cord blood. The size of the bubble is how much research has been done. So the bigger the bubble, the more research. So there's actually been a lot of work done in umbilical cord blood for people with cerebral palsy. Over 22 trials have been done and over 700 children, almost 800 in a trial. And there's been many, many more people who've privately bought cells. And so we can say that this definitely works, and I'm going to show you some data. It's not yet approved, but it's definitely effective. It's actually more effective than rehabilitation by itself. So we actually need to work really hard as a community of scientists, researchers and families together to actually get this approved. So that's a really exciting sort of state of the science for cerebral palsy. The next one is something called mesenchymal stem cells, and over 1,000 people with cerebral palsy have also had those. So you can see it's a bigger yellow bubble. It's rising, a bit like champagne, rising up towards the green, and it'll probably go green at some point, but it's a promising looking intervention as well. And then neural stem cells and bone marrow have had a smaller amounts of research. They're smaller bubbles. We know less about them, so they're sitting closer to the worth it line. So that gives you a bit of a snapshot of which things are working. You can see we don't have anything in the proven not to work category yet. So it's actually a promising sort of field. So what's involved? Well, it really depends on the kind of cell that you choose, what's involved. So there are two ways we can put cells back into the body. We can infuse them, so something like a drip that you have in your arm. So if you infuse things and they're going to circulate, after a while your body will say, they're not my cells, I'm going to clear them. That's what your immune system does. But it can have a temporary treatment benefit. So while it's in there circulating, it can make other things happen. That can have a lasting or a permanent effect, but the cells themselves are temporary. They only stay different amounts for different times. So mesenchymal stem cells visit for a day, umbilical cord blood visits for about 3 months, and hematopoietic stem cells, it depends how you put them in, how long they stick around. But they have a treatment effect. So if you thought about something like Botox that has, you put it in, it works and it wears off, it's a little bit like that with anything you infuse. The other way to put cells in is called a transplant. So we usually put them in via surgery, and before the surgery we clean your immune system so that it doesn't reject the cells. So if you thought about having a heart transplant, you take anti-rejection drugs. It's a little bit like that. We clear the system down, the immune system. We put the cells in, we transplant them, and we also give you anti-rejection medication so that you don't clear the cells. And so that's a transplant. It's much more involved medically, but you have to do that for something like neural stem cells because they don't stick around otherwise and they don't have any benefit. So there are different, how invasive it is depends on which way you put the cells in. Where is it done? They can be done in hospitals. If it's an infusion, they could also be done in an outpatient service. Always you want a team that's very familiar, because anytime you don't want to have an allergic reaction to the product or something like that, you want people on standby to be able to support. Who is it for? So as research progresses, we're understanding better about who to treat and when. So in childhood, we could think about umbilical cord blood, and we know it works better than mesenchymal, and that's probably because it sticks around a bit longer. In infancy, we think mesenchymal stem cells might be very helpful, and we can treat earlier. How much is needed? Well, there's a trend towards higher doses, but they're not interchangeable between the different cell types, so that's important. So where are we going next? I'll just finish with one or two slides showing where the field's heading. So we're going to see probably a big phase 3 trial next. So if you look at these different columns, that's the different phases of research. We start at safety, then we look at preliminary efficacy, and then we do a definitive trial, which is the red column, which is what a regulator needs to see. Something like the FDA needs to see something in the red column before they approve a treatment. That's what I think will happen next in the United States of America. We're using umbilical cord blood for CP, and that's when you'll get an approval number. I think we're getting close to that actually happening. This is data that we have recently done. It's unpublished, but just to show you that we've combined all the children around the world that have had umbilical cord blood. And the first thing we can see here is that there's what we call a dose response curve. So the higher the dose, the bigger the result for gross motor function. So this graph actually tells us that we haven't even hit the maximum dose we could go. So we could push doses higher. The field started really small, really conservatively, but we can probably go higher, which is good news for everyone that's had a small benefit, because maybe we could go up to a bigger benefit. And this curve, interestingly, perhaps it's a little bit disappointing, but perhaps not surprising, we can see an age response curve. So younger children do better. That's probably because they got more inflammation. So there's more cells for them to target. This is with umbilical cord. And lastly, we've been able to push these trials down into newborns. So we've been doing an umbilical cord blood trial in Australia with babies born very preterm. And we're also just about to open a trial for babies born with a stroke that are going to get 2 doses of mesenchymal stem cells in the first week of life, and look at their outcomes to see if it reduces cerebral palsy. So if you want to understand a little bit more, you could go to this QR code. It'll take you to our website, and we've got a whole bunch of videos there that go through that with 2 of my amazing colleagues, Megan and Madison, who are scientists and are really good at explaining science. So thank you very much for your time.